Good afternoon, everyone. My name is Chris Lanning, and I'm back here today at the Indianapolis Healthplex talking about corrective exercise again, more specifically all stretches today. So we're going to be using a few different techniques, and so a lot of clients that I see here in the facility, they have a lot of tightness and what we call trigger points or knots. And there are certain areas or certain hot spots within the body that develop these trigger points, these knotted up areas. And so we're going to talk about how to get rid of those knots today, how to get rid of some of that tightness, how that plays a role into overall exercise. And so, so my biggest question, like I talked about earlier, have you ever had a knot on your upper neck where you feel like it just gets really tight and it kind of gets into this knot? You probably have felt that before, whether you're working at a desk for a while. If you're working from home right now, you get into this forward head posture, rounded shoulders, and I'll talk a little bit more about posture here in just a little bit and how that plays into exercise and how tight muscles can kind of limit our range of motion and set you up for injury. But if you ever have had that tightness, usually those are on the upper neck areas. If we've been sitting for long periods of time, these are usually areas along what we call the levator scapula muscle or upper trapezius. So those are just the muscles that go from the back of the skull all the way down. So levator, meaning elevation, and then scapula, meaning just the shoulder blade on the backside. So you throw those two words together, and that's exactly what this muscle does. Is the levator scapula muscle back there. It goes all the way from the back of the skull down to the top superior border angle of the scapula. So that muscle gets on stretch a lot of times throughout the day. So there are three specific ways today that I'm going to focus on how to release some of those tightness, those trigger point areas, those knots. And basically what these knots or these trigger points are, they're just a taut strand within the muscle fiber. And it usually gets overstimulated through exercise, if you're working out a lot throughout the day, or it's just when you're unable to release a contracted state of a muscle. So in other words, again, if you're working out, you're doing a lot of physical activity, and you don't stretch before or after, this muscle remains in a contracted state. So, and we'll talk a little bit about that today. And when it's unable to release this contracted state, you remain in this shortened muscle. And so that sometimes will develop these trigger point areas within this muscle belly. So we'll kind of talk about that. And then overuse, or if you're on stretch for long periods of time with a muscle, those also contribute to trigger points. So again, going back to the point that I made earlier, and I'll show you an example, is if you're sitting at home and you're sitting at your desk, and maybe you're working on the computer on your laptop for a few hours. What happens? You start maybe in a good position at the beginning of the day, and then what happens over time, after a half hour to an hour to 2 hours, our gravity starts taking us forward. So our positioning, we get rounded at the shoulders. I call that the turtle shell position. And then we get a forward head posture, and then gravity eventually takes us forward. And so that's why positioning of your computer when you're working is really important, trying to maintain about eye level, so that these muscles back here, these upper trap muscles, cannot be so much on full stretch. So again, if they're like this, they're on a full stretch, and then you develop these trigger points or these knots right in between the shoulder blade, which many of us have experienced before. So I'm going to talk about three different ways today, using a foam roll, using a tennis ball, and then using a Theracane in order to get rid of some of these knots. So this is going to be really important. I see sometimes people come in and we want to do exercise with them, but their muscles are so tight that we're going to be setting them up for injury if we don't get rid of some of these trigger points, some of these knots initially, in order to open up more mobility, therefore more range of motion if they're able to do exercises safely. So very important there. So I usually tell people, if you're going to use a foam roll or a tennis ball or even a Theracane, to usually hold over the tight area or that knot for about 30 seconds. Usually put about 30 seconds of pressure. This usually relaxes the muscle, brings blood flow back to that area, and brings it back to that normal state that it needs to be in. So that's not clumped up in one area. So the first thing that I'll show you is a Theracane. So these Theracanes are pretty cheap. They're about $20, $30 online on Amazon. They're fairly cheap, but the nice thing about them is you can hit a lot of different areas. And so today I'm going to show you that muscle that I just talked about, that levator scap muscle, and that upper trapezius. Again, these muscles on the upper neck side that a lot of times when we're in that forward head posture get tight and then develop these trigger points. So if you have a Theracane, that's great. Follow along with that, or you can get one. Or if you don't have one of these, I'm going to show you some alternative routes that you guys can do at home as well. Again, using a foam roll and a tennis ball or a lacrosse ball, something like that you guys can use. So what I like about this Theracane, and there are different varieties that you can get. The main one that first came out was called the green Theracane. It's green. It doesn't have quite the S shape like this one does. It's about half of this. It works just as well. All of them are going to do the same thing. I kind of like this one the most because it's in a long shape. It's got a lot of knobs for different areas that you can work. So I'm going to show you some areas that are some of these hot spot areas on your back, also on your low back, upper back, mid back, some areas that you guys can kind of focus on here at home. So if you have a Theracane, the nice one about this one is it's got a lot of knobs on that front part where it curves a little bit here. So what I usually tell people to start with is just go ahead and put it on and around your shoulder there. The nice thing about this one is that when you do that, it'll hit a lot of different areas at one time. So I'm going to turn around here. You can see that what it's hitting on the lowest part there, on that lowest knob, is my rhomboid. So my rhomboids, they're in between the shoulder blades, and they help me to retract the shoulder blades, the scapulas, same kind of motion where we're doing a row. Those kinds of things are really great to hit on. Sometimes they get also an overstretch if you're in a slump position a lot throughout the day on your computer. So again, what I tell people is go ahead and find some of those knotted up areas. And you may find that they're in between the shoulder blade and the spine. You may find that they're a little bit higher up. One main spot that I see a lot of is that levator scap, that upper trap kind of levator scap area. So if you find your shoulder blade, that top angle of where that is, a lot of times I'll develop a trigger point there. So you can kind of, again, put pressure through that. I usually say, do it for about 30 seconds or so, 30 seconds to a minute. I like to do a circular motion with this as well. Some people like to just kind of lay into it a little bit and try to release some of that tightness, that knotted up area. I usually try to do a little bit of a circular motion. Again, it kind of makes it feel a little bit better so that you're not leaning right into that knot or that trigger point. So that's one thing that you guys can use for that. So a lot of times on these Theracanes, they'll have little knobs somewhere. So this one has a couple knobs right at the top of that S curve. So what you can do with that, so if you've ever had headaches, any kind of tightness, we call these suboccipital muscles, but they're the muscles that are right at the top. Kind of you feel that big bump on the back of your skull. If you go down, those muscles in through there, if they're really tight and tense, if you have a lot of stress, you want to definitely try to massage those out. And so those can create headaches too over time. So the tension headaches, those kinds of things that you may have heard of. So what I usually try to do is space out that gap in between the two knobs and put it right on that upper neck area. And you can put that space in between where those vertebrae are so that you're not right over the top of the bones there. I like to just go up and down, just do a nice massage there. And that feels really good there for me. Just going up and down. Again, you can do this for about 30 seconds to a minute. Just going up and down like that. That usually will help take some of that tension, some of those tightness areas of your upper neck out. Kind of going back to the one that I just showed, with all the knobs on this one, the nice thing is that not only am I hitting in between the shoulder blades, as you can see here, I'm also hitting that upper trap area, that upper neck. And then as I'm coming through the front side with this one, I'm also hitting some front part of the delt area as well. Some of that delt pec area, that conjunction there, that sometimes gets tight with people. You can roll it over that bicipital groove. So the bicep, if you do a bicep curl, the front part where that originates and inserts, you start up here, go all the way down to where the elbow meets. And so you can kind of do a little bit in through that front side too. Sometimes that front part of the shoulder gets a little bit tight as you do some exercises. So those are some main things for the upper body that you guys can do. As far as the back, one thing that I like to do too, if you feel like you get some tightness, some knots in the low back, is to go ahead and wrap it around, and you can feel some of those tightness areas. And then again, you just kind of massage around with this. Usually feels pretty good. About 30 seconds to a minute usually works pretty well. And again, the purpose behind all of this is that you're releasing a contracted state. So the muscles, again, when they're on stretch or they're overactivated, they get really tense, they get really tight. These muscle fibers end up getting locked up into a big knot. And so you're trying to release that. Once you release that, it allows more blood flow to that area, and again, kind of smooths out everything. So a good example I can kind of talk about here that I talk about with individuals is when muscles get really tight, it's kind of like this, where everything's overlapped, nothing's parallel, everything's kind of going up and down, everything's knotted up like a rope if you're to tie a rope that's really tight. But then as you get rid of some of these knots, some of these trigger points, everything becomes more parallel. The muscle fibers become more parallel, and that's what you're looking for, so that you're not getting this tightness within these muscle areas. So just something to think about. How does this affect exercise? So it affects exercise because it affects your mobility, your functional mobility. It affects your ability to go through full range of motion. So those muscles that I just showed you, those upper neck muscles, the kind of upper trap areas there, the rhomboids on the back side, those mid-back areas around the shoulder blades, they can limit the amount of shoulder mobility that you have. So if one shoulder is a little bit tight, maybe you're working on the computer for a while and you're trying to maybe do some shoulder elevation workouts, sometimes you may notice some tightness, but then also it increases the chances of injury. So this video is for everyone, including myself. Whether you're young, you're in high school, you're middle-aged, you're older, and if you're an athlete out there, we see a lot of these trigger points, a lot of these knots within athletes as well. So it's important that even as you exercise a lot, that you're doing a lot of stretching, use a Theracane. If you don't have a Theracane at home, tennis ball or lacrosse ball works really well. And so you can kind of still go over those areas that I was just talking about. You can actually go up to a wall and maybe put the tennis ball back there and just roll over those areas, like so. Some of those areas I was talking about earlier. You kind of do it on those suboccipitals, so those muscles again that are right on the upper neck area where you feel like the skull comes at the top all the way down to that upper shoulder area. You can use a ball to do that as well. Last thing that I usually kind of help coach people on is using a foam roll. And so you can go out to the store and get a foam roll too. They're fairly inexpensive. You can get different sizes of them. This is a large size that we have here at the facility that you can roll over the hamstrings, the quads, the IT band. So I like using that as well. I usually say that the foam roll is more for kind of waist down, unless you get one that's a little bit smaller than this. And then waist up, I usually like to use either the Theracane to get some of that tightness out for mobility or a tennis ball or lacrosse ball that you guys can use too. So just some options there. But going back to posture real quick. So again, if we're in bad posture, we're going to be using the muscles a lot that are on the upper part of the neck area, and they're going to be on stretch a lot, which creates a lot of that tension down and through this area there. And so posture at work, at home, extremely important. We talk a lot about posture technique in the clinic, and so it's something that is really important that we utilize here, and that we make sure that everyone's on board with, because if you're doing an exercise and you're not doing it with correct proper form and technique, you could be setting yourself up for injury. So we want to make sure that that is good as well. Just some helpful hints as you're in a chair that you guys can use. So one thing that I like to do too, if you have a foam roll, is to go ahead and put it up and down on the chair, and then you put it right in line with your spine. And then what I like to do is go ahead and bring the arms straight back. It'll give you a nice pec stretch there. So that's something that people that work at home, they're sitting a lot throughout the day on their computers. Doing something like this is nice and easy. Again, allows you to release some of that tightness, release some of that stress as well. So when we're slumped over position a lot throughout the day, if we can go in the opposite direction, that is usually really good for anyone that develops more tightness, more stress, more trigger points in some of those areas. So there's something to think about there. We talked about last week shoulder blade squeezes, and so that's something as well, that if you develop these knots in between the shoulder blades or up on the upper part of the neck, shoulder blade squeezes, so coming back, really focusing on pinching something in between the shoulder blades, really try to bring those shoulders back. Those will help release some of those tightness areas as well. So again, if you're thinking about your posture throughout the day and you're leaning forward a lot, you want to go in the direction that you're not in most of the day. So squeezing your shoulder blades back. One thing that you'll notice is I'm not hiking up my shoulders when I'm doing this. So my shoulders are going backwards. They're not going up and back. They're staying nice and loose, staying relaxed and down. And I'm squeezing the shoulder blades straight back, just like that, just like you're pinching something in between the shoulder blades. So if you do the Theracane, or you're using a tennis ball or something like that to get some of those tightness areas out, a lot of times it's good to go ahead and do just a few repetitions of those rows. The shoulder blade squeezes, nice and easy. You use a little bit of weight with these as well, but that kind of smooths everything out after you get some of this tightness, those knot areas out. So just something to think about there as well. And another thing that I'll show you. So last week we talked about shoulder mobility, shoulder tightness. If you're trying to go straight ahead, and what we see here at our facility a lot as we do the functional movement screen and look at shoulder mobility is you'll start seeing people do kind of one of these where one side of the shoulder maybe isn't as mobile as the other side. And so we want to try to correct that if we're doing any kind of especially upper body exercises with people. You don't want to put a movement on top of a dysfunction. So something that you guys can do at home. And I showed this last week too. You can use a foam roll if you want. If you just want to start basic, you don't have to use a foam roll. But go ahead and lay on top of the foam roll. And these are called snow angels. And so what you'll do is you'll go up to about shoulder height and then back down. So if you can, and I'm a little bit tight here as you can see, but try to keep your elbows actually on the floor during the whole motion. And so again, going up, and you can actually go straight up over top, give yourself a nice stretch that way, and then back down. And again, if you're extra tight through the shoulders, you may not even use a foam roll to start out. Just go straight on the back do this in bed. Nice exercise to do in the morning, just to kind of get everything warmed up again here. So you do a few repetitions of these. You can also do these up against the wall too. So you can go up against the wall. Same concept. You start down low and then really try to squeeze the shoulder blades back. So just what we talked about earlier, you're kind of doing a retracted state where you bring the shoulder blades, pinching them back, and then you're going up the wall, again, working on shoulder mobility, and then back down. You want to try to, again, keep the back side of the elbows on the wall, touching during the whole motion there. So those are some other great examples of exercises to do after you get some of those knots out, some of those tightness areas out as well. The cool thing is it incorporates a little bit of that scap squeeze, like I mentioned, so you're kind of hitting two with one there. Another good exercise to do at home is the cat and cow. Probably have heard of this before. And so this is really good because it's hitting two things as well. It's kind of hitting a lot of that transverse abdominis, so the core that we talked about last week. You're working on that, engaging, activating the core, but then you're also doing a little bit for your mid-thoracic spine, and then really trying to work the muscles along the spine, those paraspinal muscles, some of the low back here, again, trying to go into almost a curved motion here. So I explained you're going to be on all floors here. And what you want to do is drop your head down and lift straight up your back here. And then you'll come straight down, kind of sag your hips down, and then also your core down. And then when you go back up, something to think about is engage the core. So really try to draw in that core, and then put down. Really try to round that back. Hold for a few seconds, and then back down. And always bring that head back up. So we're kind of doing two different things here. Drawing the core in, looking straight down. Really try to draw that core in. Nice and tight. And then back down, just like that. So that's something that you guys can focus on too. You can also do a rotation with that same position on your hands and your knees there. This is a good little exercise. I'm going to move the mat this way to show from a little different angle here. And so one thing I like to do as well is go ahead and go out. Really try to open up that thoracic cavity. Try to open up that space for breathing. Nice deep breath in and out. And then go ahead and come in and rotate back. So it's a good exercise you guys can do. I like it because it's really stretching out back as you're twisting here. And if you want to turn this into a little bit of a core exercise, you can really focus on, again, trying to draw that core in as you're going in and out there. So we'll do it on the other side. So again, straight out, really try to come back with that arm, and then swoop in and around. Hold that position, come up again, and swoop down, around. Hold that for a few seconds. Also a really good exercise there. Child's pose. So those who have done yoga before, those positions that are down that you have probably done before, the child's pose position, really trying to stretch out that back. You can do different angles of this. So you can kind of move your hips to the opposite side that your arms are. And again, kind of reach forward. And you should feel stretching the opposite side of the side that your arms are out on. So go back to the center. Nice stretch there through the upper back, lower back. And we'll go out to the other side here. Try and bring the hips to the other side that our hands are on. Again, you can hold that for a few seconds. It feels really good through the shoulders as well. So you're getting a little bit of a back stretch, a little bit of a shoulder stretch. Good to do there. One thing that I always get asked a lot of is like, what can I do in the mornings to allow more mobility in my low back? It feels like my low back gets tight a lot. And so one exercise I like to always show people in the mornings that they can do, it's very simple, is you can start on your back and then go ahead and bring your knees side to side. Again, if you've had any back issues or anything like this, just be cautious. If you feel like you're having back pain with this rotation, just go ahead and stop the exercise. But it shouldn't be too bad if you're just doing a little bit of rotation. People always ask, well, how much rotation should I do? Do it to a comfort level. I usually tell people just start off small here first and go side to side. Again, kind of loosen up that back a little bit. Another thing that you can do is go up into about 90 degrees, kind of do the same thing. If you have a yoga ball, you can put underneath as well. Nice thing about this is it kind of massages your low back. So it kind of helps get some of those tightness areas out of your low back as well. You can hold these for a few seconds on both sides. That feels really good. Again, massages that low back, the lumbar spine area. Go over again to a comfort level with these. And then back. And then something else to do too, you can do the knee to chest. A lot of people have heard of that. I've done that before, the Piriformis Stretch. So I'll show some of those here as well. So the exercise that I just showed you side to side, the knee to chest in the mornings before you get up out of bed. These are some great exercises to do. Just kind of start off your morning. Do these throughout the day, halfway through the day, at night. Get a nice stretch. Hold. Usually tell people between 20 and 30 seconds on both sides. And again, stretches, just as a reminder, stretches should always feel good. So if you're going too far with a stretch, with motion with it, and it's causing pain, you know that you need to back off just a little bit. Again, you want to go to the point of comfort and not pain with any of these. So you can do double knee to chest as well. So again, that kind of stretches out the low back area. Again, hold for about 20, 30 seconds with these. Should feel a nice stretch in your back. Some other things too, so we talked about child's pose. I'll show you a Cobra real quick. That's a term for yoga. If you guys have done yoga before, probably heard of that as well. The Cobra position is really good for people who have had maybe like sciatica, numbness, tingling going down the legs before. I usually tell people that start out on your elbows first, especially if you're a little bit older, you're a little bit hypomobile, so you don't have as much mobility in your lumbar spine or your thoracic spine. Start off with just on your elbows and then progress to up onto your hands here. So I'll show you this. Again, you can hold these for a few seconds. You can turn this into an exercise as well. So again, laying on your stomach and then going up onto elbows. And then if that feels pretty good, you feel like you can do a little bit more with this, you can go all the way up to kind of a push-up position, leaving your lower half of your body on the ground, lifting up to the front, halfway up here. Then you go back down. Again, you can turn this into a little bit of an exercise too. So you can go up, hold for about 2 or 3 seconds, and then back down. So positioning this is important with your hands. So if you actually don't want to do quite as much range of motion, you can move your hands forward a little bit. If moving back was too much, you can move them forward and get the stretch that way too. So hand positioning can become important with this exercise too. This feels really good. You can hold this for about 20, 30 seconds if you can. Give it a nice stretching through that low back area as well. Another cool one that you guys can do too, kind of just developed this when I was playing around with the foam roll one day for shoulder mobility and just stretching. You can take a long foam roll like this, or if you have just a pole, PVC pipe, something like that, a broomstick handle. Hold it like this, and then you can actually go up and back, and that also kind of squeezes between the shoulder blades, works on a lot of good shoulder mobility, releasing some of that tightness. That feels really good where that is there. And so that's another thing that you can do. Piriformis Stretch. So many times people have heard of this if they've gone through therapy before or looked up stretches online. The Piriformis Stretch is really good. Biggest thing with the piriformis, so the piriformis is deep to the glutes, the glute max specifically, and it's kind of in a triangular shape. Sciatic nerve runs underneath it, and about 15-20% of the population actually bifurcates it or goes through that piriformis, that sciatic nerve does, and that's where you can have some of that irritation, some of that numbness and tingling. It's important to stretch out these muscles from a standpoint of you don't want them to flatten out and become too tight. It can restrict certain range of motion, but then cause injury and other things nerve-related too. So that's why stretching is so important. We'll go ahead and show you the piriformis stretch here. And so you're going to put one foot on front of the other, on top of the other leg, and then you can go straight up and over. There are a couple different ways you can do this. Kind of go straight up and over like that. Kind of gives you a stretch down and through a little bit more of that IT band area through those hamstrings. And then you can also push down and then bring the other leg up. So that's usually where most people feel the stretch. If you're not bringing that opposite leg that's on the ground up, usually people don't feel this stretch quite as much unless you're really, really tight. So you want to bring that opposite leg up with you. And then again, hold anywhere between 20 and 30 seconds to hit more of that piriformis muscle. So that's a muscle sometimes we forget about, especially again as we're in a seated position a lot throughout the day. So a lot of these things are, if we're in a seated position, working at a desk a lot. So these are some just techniques, some things that you guys can use at home. You can do a seated hamstring stretch as well. So if you feel like you're busy throughout the day, you're working at home, you're trying to find a way to incorporate stretches, but you can't necessarily have the time to get up and do some of these exercises, just doing a simple hamstring stretch like this in a seated position. You can use a towel and put it around your feet or your foot there, and you can pull on the top part. And again, that'll give you a little bit of a stretch, not only through a little bit of the hamstring area there if you lean forward, but then through the calf area as well. Such as something you can raise it up, feel a little bit more of a stretch, raise that foot up just like that. So other thing too is a quad stretch. So you've probably seen different kinds of quad stretches. You can lay on your stomach and you can use a big towel and you can pull the leg back. You can use a dog leash, a belt, something like that to use in order to stretch out the quad. I usually find that just doing a simple standing quad stretch, bringing one leg back, works pretty well. You can do that too, and you should feel that top quad muscle. Feel like you're getting a little bit of a stretch. Again, you can hold on to something, but you feel like your balance is a little bit off. You can definitely do that as well. So, and then dynamic stretches. So we talked a lot about static stretches today. Dynamic stretches are just as important, especially before you start working out, so that these muscles that we've tried to really loosen up, get the tightness out of, you can also do dynamic stretches, and that'll kind of help with that whole process as well. So have shown this on previous videos, but just a simple standing high knee to chest, hold for a few seconds. You can do these kind of walking. You can do this a little bit higher intensity as well. I've seen some athletes that like to do this where they're doing it, holding and doing it quick again down through a track area or on a football field. So these are different things too that you can do. Again, kind of working the inside muscles. You can do, again, these stretches and going side to side for about 20, 30 seconds as well. You should feel those adductors, those ADD muscles, those inside muscles of the thigh. Feel like they're getting stretched out there. Last couple that I'll focus on today, I know we've gone through a lot today, but wanted to go from top head all the way down to the feet. Stretches that you guys can do, again, that are easy, right? A lot of these don't require a lot of effort, don't require a lot of equipment. If you want to go out and get a foam roll, that's great, or a Theracane. If not, a lot of people just have a tennis ball or something like that at home that they can use to do some of these releases that I'm talking about in order to help with mobility and prevent injury when you're doing workouts. So next one that I'll show is a hip flexor stretch. Now, I showed this one last Friday, and this is a stretch that we sometimes forget a lot about. And so this stretch, so the hip flexor, so it's kind of what it says it does. So we talk about the hip and then flexing. So flexing, going straight up, doing kind of a march, if you think about going up and down steps, that kind of thing. Some people don't necessarily have the range to do certain exercises, whether that's knee to chest, or if you're doing a squat, or using any kind of your glutes, your hamstrings going straight back. The hip flexor stretch is really good to do. So I'll go ahead and show that to you guys real quick. And so let's take it out here a little bit. And so you want to go towards the edge of a bed, and you want to get towards the very edge, and then you'll lean on back, and then go ahead and pull one knee to your chest, and let that opposite leg that's down, just let it relax down there. And you should feel a nice stretch. You can actually bend the knee. I usually find that this stretch, you may need someone to kind of assist you with to help bring this opposite leg down. But you should feel a couple different areas stretch, but mainly on the front side of the quad. And then up and through kind of the groin, that hip area, you should feel stretching through there as well. So if that gets too difficult where you don't feel stretch as much, again, what we showed you last week, you can put down a pillow down to put your knee on for some extra support, and then go ahead and lean forward. And that is the same exact stretch there, really stretching out, again, this side that's going back. So you should feel that stretch on the front side there as well. So good stretch to do throughout your day. Again, because we're in a position a lot throughout our days where we're on the couch, we're in a seated position, and then we kind of slump forward, and then we get a lot of tightness in through the hip, the glutes, the piriformis muscle, and then again through the rhomboids, the upper neck muscles, this upper trap that I talked about earlier today. And then last one that I'll show you really quick here is calf stretch. And so again, we're going to kind of start at the top of the chain, go all the way down here today with stretches. Last one I'll show you is a calf stretch. Now, I'll show you a calf stretch how normally people do it, and then I'll show you a little bit different way. And so, so you can find a step. You have a step at home that works perfect. And so, a really fancy word for the calf muscle is a gastrocnemius. If you want to impress people, you can mention that to the people. The gastrocnemius, you can look it up online. It's just the calf muscle. But what you can do is you've probably seen the stretch done, have done the stretch before, but put one foot up and then go ahead and lean forward so that you feel a stretch down and through that calf area and through that hamstring area as well. You kind of go straight ahead. You should feel a nice stretch the more that your toes actually come up. And then, so that's one stretch that most people have heard or have done before. The other muscle that's underneath the calf area and underneath that gastrocnemius, that big muscle, is called the Soleus Muscle. And so if you want to look that up online, but it falls underneath kind of where that big calf muscle is, kind of down towards that Achilles area. But one way that you can stretch that is you will actually bend the knee and then do that same thing where you're bringing the foot straight up. So this is the bent knee position, and you should feel that a little bit different stretch. So notice it's just a tight, a little bit different stretch than what we just did where the leg was straight out. So you want to do the knee bend, doing that as well. If you have something to hold on to, I don't have that here, but you can actually do both at the same time. So some just quick stretches, some pointers, but just to review, obviously trigger points, not tightness throughout your body. If you're doing that on top of a movement, you could be prone to getting yourself into injury. And so you want to make sure that you're doing what you need to do as far as stretches dynamically, statically, before and after. I usually recommend more of the dynamic warm-up before, static stretches afterwards, foam rolling, using a tennis ball, and then a Theracane as well. Just some pretty inexpensive ways to help with some stretching and some tightness. So love you guys, miss you guys, and hope you have a great rest of your day. And then I'll be back this Friday to talk a little bit more about corrective exercise as well, focusing on a little bit of balance, a little bit of stretching, and some other areas too. So take care, guys, and have a great day.